Welcome to This Explainer. Today, we're diving straight into something we've all experienced, a seemingly harmless symptom that actually demands a massive, multi-layered public health response. You know, we brush off countless minor ailments every single day, right? But today, we're going to unpack the fascinating and, honestly, sometimes kind of alarming reality behind one very specific everyday complaint.
So, a scratchy throat. We naturally assume it's just a temporary, harmless inconvenience, maybe just a sign of the changing seasons. But I want to pivot sharply right here, because that assumption, it can actually be incredibly dangerous. We usually delay getting medical care thinking, hey, I just need some rest and maybe a warm cup of tea. But when we actually look at the clinical data, treating every sore throat as just a cold is a risk we literally cannot afford to take. Especially, and I mean especially, when we're talking about kids and teenagers. Just take a look at this quote from a clinician. It really hits home the devastating emotional stakes when a simple sore throat escalates. What starts off as a minor complaint can, if we ignore it, snowball into acute rheumatic fever and cause permanent heart damage. Families are frequently caught totally off guard. They're left wondering, wait, how on earth did a tiny tickle in the throat lead to a serious heart condition? Well, to answer that, we've got to look under the microscope at what's actually causing the infection in the first place. Section 1, viral versus bacterial causes. Let's get into it.
Okay, so there's a really crucial contrast here. Viral infections are by far the most common cause of a sore throat, and they usually bring a cough along for the ride. But let's look at the bacterial side of things. If a child has a fever, swollen, tender lymph nodes, maybe some white patches on their tonsils, and absolutely no cough, that is a massive red flag. This sharp contrast is an absolute game changer for caregivers. The total absence of a cough combined with a bad sore throat and fever means we need to immediately suspect strep and get a professional medical assessment. No waiting around.
Let's get specific about the culprit here. Group A streptococcus, or GABS for short. It's a highly contagious bacteria. But get this, the real danger isn't actually just the bacteria itself, it's our own body's reaction to it. If this bacteria is left untreated, a child's antibodies, the exact same things designed to protect them, get confused. They go rogue and mistakenly attack the heart valves. That is exactly what causes acute rheumatic fever. Understanding this specific bacterial trigger really explains why a rapid diagnosis is absolutely non-negotiable as our first line of defense.
Moving on to Section 2, when to actually seek care. When it comes to taking action, timing is literally everything. Step 1 is straightforward. Just notice the symptom. Pay close attention the second a kid complains of throat pain. Step 2 is where we spring into action. Get a rapid throat swab culture immediately. Don't wait a few days to see how it plays out. Act fast. And step 3? Well, this is actually the toughest behavior for public health campaigns to enforce. You have to complete the entire 10-day antibiotic course. Even if the kid is bouncing off the walls feeling perfectly fine by day 3, the bacteria might still be lurking. If you stop early, it survives and can trigger that devastating immune response we just talked about. Now, while the antibiotics are doing the heavy lifting to wipe out the strep bacteria, we still need to manage the immediate day-to-day discomfort. Simple things work wonders here. Saltwater gargles can soothe that irritated tissue, and giving them ice chips or frozen juice pops, that numbs the pain and keeps them hydrated. You can also use acetaminophen to get the fever down and ease the body aches. Oh, and keeping the home free of smoke and other irritants really helps speed up recovery. These are super practical, actionable self-care steps that just keep the kid comfortable while the medicine works its magic.
All right, Section 3, the power of messaging. Because think about it, having a cure doesn't mean a thing if nobody knows when to use it, right? Check today, don't delay. Catchy, direct little jingles like this act as a sort of Trojan horse. They use simple, repetitive, rhyming formats to deliver urgent, life-saving medical warnings directly to the public. Health promotion campaigns lean heavily on this cognitive strategy to basically cut through the noise of our busy daily lives and actually change how caregivers behave.
But hey, awareness is only half the battle. These campaigns are designed to ensure that once a caregiver spots the danger, an entire support system is waiting to catch them. For example, by promoting free sore throat clinics in high-risk areas like Porirua and Auckland for kids and teens aged 4 to 19, that huge financial barrier is completely wiped out. Plus, public health advice pushes for swabbing the whole family if just one person tests positive, simply because strep spreads like wildfire. And if someone is unsure of what to do, there's a dedicated health line to give immediate guidance. It creates this awesome, comprehensive safety net.
Which brings us to Section 4, individual versus public health.
Now here is where the story gets really, really interesting. Just take a look at this number. 38%. Strikingly, 38% of participants diagnosed with acute rheumatic fever in one study didn't even remember having a sore throat before their diagnosis. The symptoms were either incredibly mild or they just missed them entirely. And wow, does this ever expose a massive limitation in our approach? Think about it. If there is literally no sore throat for a caregiver to treat, then all the rapid swabs and strict 10-day antibiotic courses in the world aren't going to prevent the heart damage. It forces us to step back, look past the individual patient, and zoom way out to the macro-environmental level. We have to ask, why is this bacteria spreading so aggressively in the first place? Well, the answer lies heavily in our environment. Research shows that a staggering 75% of recent acute rheumatic fever cases lived in rental housing and reported multiple measures of socioeconomic deprivation. So you see, this isn't just a purely biological issue anymore. It's a deeply structural one. When we actually break down these environmental realities, the numbers are pretty stark. 82% of cases lived in cold housing. 76% were dealing with dampness and mold. 58% experienced household crowding, and almost half were bed sharing. This data undeniably connects a biological illness to systemic, everyday environments. When folks are crowded together in cold, damp homes, the group A strep bacteria has the perfect, highly contagious breeding ground to transmit from person to person, and often it happens completely silently. So to truly protect kids, health promotion has to transcend the pharmacy. Yes, absolutely, we need the antibiotics, but we also have to advocate for sweeping, systemic housing improvements. Implementing minimum enforceable standards in both social and private rental sectors, something like a mandatory housing warrant of fitness, could fundamentally disrupt the transmission of the bacteria before a child ever even needs a throat swab. Simply put, we have to treat the environment if we want to treat the disease. I want to leave you with this provocative thought to ponder as we wrap up. Can we truly cure a sore throat without fixing the home? It challenges us to recognize that effective, modern health promotion requires a dual approach. Yes, it needs the antibiotic in the medicine cabinet, the rapid swab at the clinic, and that catchy jingle on the radio. But it equally requires the structural integrity, the warmth, and the safety of the walls surrounding that very medicine cabinet. Thank you so much for joining me on this explainer. I really hope this gives you a whole new perspective the next time you hear someone say, "Oh, it's just a simple sore throat."